that was advocating for him, and there was definitely not a PN or a PSW or any member of the healthcare team that was really doing their due diligence to really help him, I felt. And that is very unfortunate, but it drives home the importance of patient focused care as a healthcare professional to practice this at all times so that we don't have a lot of Walters. Is we don't want that. We want the best for our patients and residents, and to avoid any unnecessary complications or any disease processes that are getting worse due to just lack of due diligence. So during Walter's many visits to the hemodialysis clinic that was in Prince Albert, it's hard for me to think that nobody knew that he lived 4 hours away and how he was getting there. For me, as a healthcare professional, that would be include my general survey when I initially met the patient. Well, I see that you live 4 hours away. How are you getting here? And I think Walter could have benefited just alone from that basic question, because there could have been the PN could have looked into services that perhaps I know there's one here in Fredericton where it's free transportation for like healthcare appointments under under certain criteria. But for example, like dialysis patients I know is one, and cancer patients is another. So, and also, nobody had inquired about his mental health needs and how is he managing his depression, which I have a hard time believing that nobody knew at that clinic, since he went there so often, that nobody knew that he had struggled with a moderate depression. So I know he's here for dialysis, but treat that individual as a whole person. And I think that it speaks volumes about the care that he was provided, that he was just treated for that one thing, and everything else is kind of turn a blind eye. Or at least that's how I felt when I read his story. So, and if a member of even that healthcare team, ideally, I would like to read where every facility that he visited, he experienced patient-focused care. But even if just that one place he experienced patient-focused care, I believe it would have made a difference in the outcome of his story. So and also, if they would have asked, how you, like I said, how are you getting here, then that could have expanded on another topic where, are you having any financial struggles? And he could have, and then you can either consult a social worker, look into it yourself, or you can maybe a social worker to be assigned to him, and they can together, the three the social worker, Walter, and the PN, to all work together and find solutions to his struggles that he is experiencing. As there could be special services. There could be funding that he qualifies for. There could be services that he can utilize that he just doesn't know about. And there are so many services that I've learned through this course that I didn't know even it remotely existed. And I'm like, wow. So nice. And I'm studying healthcare. So just a regular person that's not in healthcare, like Walter was in construction, they definitely don't know about those services, right? So, and that could have, and say he got funded, and also he'd be granted to, like maybe there's a grant or some sort of funding that will help him with the food insecurity that he is experiencing. Even though he has food, he doesn't have access to affordable, healthy food that is very expensive where he lives. So in my eyes, he doesn't have access to food. And he is experiencing food insecurity. So also, there could be he could be directed to a service such as, I know this is not New Brunswick, but perhaps there is something like the Greener Village. I know they have excellent programs, and they have like cooking on a budget and has stretch out your basket that they provide to individuals experiencing food insecurity. So something like that could have been given to have been provided to Walter, just with some due diligence, patient focused care, and just a little bit of understanding, and just taking that extra few moments to inquire and just ask him and treat him as a whole, holistically. And he could have benefited that greatly, as if we go back to Maslow's hierarchy of needs, if our physiological needs are met, we can move up through the pyramid. But we cannot move up through that pyramid if we struggle with those basic needs. And also, when you're struggling with I'm sure he had, like I said, he had the food insecurity because of the high transportation costs, and also he's on low income at the moment due to his knee injury and his multiple chronic disease processes. So, and also, he could perhaps he qualifies for disability benefits or partial disability. So, and that would help him take a lot of stress off his financial and his food, and it would help him eat healthier. And also, if he is less, and that would help his mental health. So, and then that perhaps it would help him even be more active. And speaking of more active, again, I find it hard to I hate to pick on this the dialysis clinic, but since he was just so often, I'm like, how did you not know these things? Where since like I said, he was there so often, how did they not know that he struggled with mobility, right? And also the doctor, if she knew that he struggled with mobility, she could have sent a referral to a physiotherapy, or perhaps like a free program that's maybe for the Y, for example. I know that there's a free program for cancer patients like that struggle with mobility. But so I'm sure that there's something similar for an individual like Walter with diabetes and kidney failure, and yeah, and also with his where he had that knee surgery. So it's definitely a lack of due diligence and a lack of patient focused care for sure. And so also if so he could have been, to further help with his mental health, he could have been referred to a counselor or psychologist, and those meetings to have been set up for teams where he did not have to travel. And also they could have, this goes for every center, they could have brought in a translator or another member of staff that knows his language. And I know I mentioned that before, but it's so important, I think, in this case. And again, like with the, he could have been like a PN could have looked into, even though at the time that is the only place he did take his dialysis, but maybe that had changed. Maybe there was an opening, or he could have been put on a wait list, or, and like I said, that's just, I feel just so important that I needed to mention that multiple times. And there's a severe lack of continuity care, and a lack of patient-focused care, cultural care, and a lack of communication within his healthcare team. That were not a team, they were not a functional unit. They're kind of, I feel like they're individual entities that were not supposed to be unbreakable chain, like I think of a healthcare team. And those cause numerous errors, like having to repeat tests, ineffective teaching due to being culturally insensitive to, and also to being impatient where English was not his first language. That should have been taken into consideration. And also, like, no matter where he was, respiratory assessment, neurological assessment could have been done. And I have a hard time believing that doctor or anybody that he had experience when, during the period of time that he was experiencing the shortness of breath, or the difficulty breathing, and also the chest pain, I have a hard time believing nobody noticed it. So I think it was just kind of just a lack of definitely patient focused care, but also just, oh well, he just came in for that and move on to the next person. So he was not treated as an individual. And also he's not being paid attention to. And I definitely should understand how he felt that he wasn't receiving the same quality of care. And also I did feel his frustration for reading the story. And it was completely warranted because, well, none of that was his fault. Like, he was trying so hard to maintain his health and also to meet all of his appointments despite all of his struggles. Well, the healthcare system and also his healthcare team was doing the bare minimum, and I feel that they weren't even doing the bare minimum. So they were just trying to get him in and out as quick as possible, but not meeting his needs. And just seeing if I Uh, um, and also since he had since it was so long for him to wait for the test results, MPN could have looked into that and see what was taking so long, and also the doctor could have consulted where he had the test done in the first place instead of just ordering the same ones. So it definitely felt that she completely ignored what he was saying to her, and like I said, instead of uh, instead of being frustrated about having to repeat yourself like the doctor, his family doctor did, I just take that moment to let's think about Walter, and when we are in that situation, and say, why am I having to repeat myself? Because if our teaching is ineffective, then it's, to me, I feel it's like the same as neglect, or just not, in like not doing the teaching at all. Because if the patient does not understand what we're trying to say to them, they're not going to know how to properly manage their disease process or their fracture, their whatever, right? Whatever they came in for. So, and that's going to lead to complications, and that's going to perhaps like further accelerated disease process, and just not good stuff all the way around. And also, like I said before, nobody had inquired about why is his diet poor, and also, like, why is he inactive? Why does he struggle with exercise? That if a healthcare professional had provided patient-focused care and listened and inquired to Walter about why is his diet poor, why is he struggle with being active, even those two things would have helped improve his situation if we had answers through patients focused care, and also for culturally sensitive care. And we just advocate for our patients Walter deserves way better, and each one of our patients deserves the best that we can give them. And we do not want to repeat this situation where poor Walter had to have his foot amputated, and that could have been avoided if his healthcare team was working as hard as he is on his health, and also if he had experienced compassion and also patient-focused care, and someone just needed to be in his corner and like listening to him and providing perhaps like an interpreter to help him understand better, so he knows how to manage. And so there's too many, unfortunately. There's many, I know, there are many people like Walter throughout Canada, throughout this province, throughout this city. And if we can just change one person, one life, let's do it. And because we've seen, I'm maybe not seeing, but that feeling that you get when you're in clinical, and I know y'all know what what we're talking about. where you know you've done everything that you can for that patient within your current scope, and how grateful that they are. And even, and just like the video that Denise showed us, just that simple therapeutic touch. Sometimes that's in, or smile, that's in just me, and that can change somebody's complete day. Especially our long-term residents and patients. Well, really, I think anybody. So, that would be the end of my discussion here.